Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in this interesting video lecture series regarding the Panchakarma. My dear friends, as you know, that Panchakarma is very important management principle of Ayurveda. That is the Shodhana Chikitsa. We have the Vamana, Virechana, Basti, Raktamokshana, and Asya. And we always do the Purva Karma, Pradhana Karma, and Paschat Karma. Similar like a surgery, like pre-operative, operative, and post-operative. Similar type of the management we require in the Panchakarma. Panchakarma is a fantastic remedy because it can avoid the recurrence of a particular disease. Today, we are going to discuss about the Basti. And as you know, these topics are very extensive. I am dividing these topics, each topic in a separate sections. As for your information, I have the playlist Panchakarma, where you can see on Ayurveda Academy YouTube channel. You can get a very simple, lucid language knowledge about the Panchakarma with the practice. We also teach online and offline about the Panchakarma treatments. We provide the Panchakarma treatments because we have the team of the doctors in Ayurveda Academy. So let us start to discuss today about the Basti Karma. Basti is a very important procedure, and today in this video we are going to see what is exactly meant by Basti. That is a little bit introduction about the Basti, action of the Basti, indications of Basti, different types of Basti, like the classification, and we will specifically see regarding the Anuvasana Basti. So Basti in the South India, it is also called as Vasti. So Basti and Vasti are very similar words. Basti word is very common in the Maharashtra, the central part of India, and the north part of India. But Vasti is very common in the South Indian part. But the meaning, the principles, actually the procedures, everything is same with Basti, or you say the Vasti. How that particular word Basti or Vasti comes? The actually literally meaning of Basti is a bladder, especially urinary bladder. In the ancient times, in the Vedic period, bladder of animals were used to conduct this procedure because one of the instruments required to give the medicated enema. Basti is easily understood by the word enema. In the modern medicine, enema is used in a very what you can say as like a pre-operative or treating the constipation, and then they give the modern doctors, allopathic doctors, they give the soap water enema. That is a very restricted or limited use of that particular concept. But Ayurveda doesn't have to do with the soap water enema. We have, of course, we have the procedure a little bit parallel to that enema, but it is not actually the functions, properties, indications, contraindications are totally based on Ayurvedic principles. So it is just for understanding purpose that Basti can be named as medicated Ayurvedic, medicated enema. Okay. So as the bladder was used as one of the instrument to give that particular medicine through the anorectal route, that particular instrument used was the Basti or the urinary bladder. That's why this procedure is further called as a Basti Karma or the Basti Chikitsa. Basti Karma, as I have said, it is a medicated enemata. In this process, medicated decoctions, that is kwath, are used. Also, the oils are used, and they are administered through the anal opening with some specific instruments that we are going to discuss afterwards. And this specifically made the Basti process. Okay. The main site of Basti Karma, where we push that material in the Pakvashaya. Pakvashaya is a lower gastrointestinal tract. Because why we are giving this Basti through the anorectal region, and it is basically acting on Pakvashaya because that is a site of Vata dosha. The Utpatti, creation, then the main activities and the pathological activities are occurring through the Pakvashaya or the large intestine, which is very important site with concern to the Vata dosha. Everybody knows there are the Vata, Pitta and Kapha. These are the bioenergies. Vata is the main bioenergy in our body because Ayurveda says that Pitta and Kapha cannot act independently. They need the stimulation or the support of Vata dosha. Why? Because Vata dosha is such energy for movement, Vata dosha is energy for the bioenergies for the movement. Pitta dosha is energy for transformation, digestion, metabolism. Kapha dosha is a bioenergy for nutrition, stability, and the growth. These basic concepts the students must understand. Okay, so this Basti karma is mainly concerned with Vata dosha to maintain the balance, to maintain the homeostasis, to maintain the physiology of Vata dosha. Basti karma is best treatment for Vata diseases. Vata diseases are mainly concerned with musculoskeletal diseases, muscles, bones, joints, ligaments, tendons. Also, the Vata dosh is mainly responsible for neurological activities or nervous system activities. So although it is a Pakvasha is the main site of action of the Vata dosh or the Basti karma, the action of Basti karma is seen throughout the body. On each and every organ, the Basti karma can be acted or can be benefited. ये बहुत फायदेमंद है बस्ती चिकित्सा, क्योंकि हमारे शरीर में वात पित्त कफ में वात दोष सर्वोत्तम और मुख्य नियंत्रक घटक है, जो पित्त और कफ के ऊपर भी नियंत्रण करता है. ठीक है. सो hence enema or the Basti treatment is the treatment for vitiated, disturbed, pathological vata. Vata is the main active and moving energy of the body. It performs the various functions in the body. It loses its balanced nature. Its functions may get deteriorated if you do the Vata Prakopak Ahar and Vihar. What is the word? Vata Prakopak Ahar and Vihar. Ahar means food and Vihar means lifestyle. For example, you are taking all the time chili, spicy, bitter, astringent type of food, then Vata will be disturbed. If you are always doing fasting, unnecessary fasting, if you are not taking proper nutritious food, then Vata will be disturbed. If your lifestyle is very hectic, and without any coordination, without timetable, the Vata dosha will be disturbed. So this is the disturbance causes that are taking place through the faulty food and faulty lifestyle. Is it correct? Vata, Prakopak, Ahar, and Vihar. Okay, let us move further. Vata dosh loses its balanced nature, homeostasis is disturbed, functions are disturbed, and then that will also affect the functions of Pitta dosh, functions of Kapha dosh, and functions of all Dhatu and Mal. Everybody will be get affected when the Vata dosh is affected. Okay, so action of Basti. Excuse me. Basti karma helps to reset and maintain the balanced state of Vata dosha and thus helps in the treatment of many diseases. Basti karma is most important and powerful treatment in the procedure among all the 5 procedures. Panchakarma. Vamana for the vitiated kapha. Virechana, purgation for the vitiated pitta. Vamana virechana basti for Vata dosha. Vakta moksha, bloodletting for the pitta and the blood. And Nastya is for the nasal medication for the Urdhvajatrukata Vyadhi. Ophthalmic problem, ENT problem, brain problem, Nastya treatment is there. But in all amongst 5 treatments, Basti treatment is called as a half treatment, half management in the Ayurvedic principles. Basti is as a Vaman and Virechana not only cleansing process, as you know, basically Vaman and Virechana are basically cleansing processes. They don't much do any other things, other functions. But this Basti is not only cleansing, there are different types of Bastis which perform the different types of functions. We are going to see the different Bastis also and their functions also step by step. Bruhana Basti, Pichha Basti, Vajikarana Basti, Yapana Basti. We are going to see all this type of Basti. Now, action of the Basti, it performs various types of functions according to the type of Basti implemented. For example, if you give the Shodhana Basti, Niruha Basti, Asthapana Basti, it is mainly cleansing process. Bruhana Basti is for the nutritive type of function. When there is a Dhatu depletion, like for example, the Raj Yakshma patient, HIV patient, cancer patient, weight loss is there. then you have to use the Bruhana Basti. Next, indications of Basti. General indication of both the kinds, Niruha and Anuvasana Basti. These are the types of Basti that I am going to explain you. Next few lines. Diseases affecting the whole body. Sarvang Vataro, whole body. Then Basti is useful. For example, rheumatoid arthritis, this is autoimmune disease. Localized diseases, ekangaro, like for example, sciatica, spondylosis. Okay, so these are the restricted to a particular part of the body. So anywhere there is a pain, Vata dosha will be there, and Basti treatment is the best treatment. Apana Vayu problems. There are 5 types of the Vayu, Vata dosha: Prana, Udana, Vyana, Samana, and Apana. Prana, inspiration. Udana, expiration. Vyana, heartbeats. Samana, digestion. And Apana, on the lower abdomen. Excretion of the urine, excretion of the stool, excretion of the semen, delivery process. So all these are under control of the Apana Vayu. So whenever there is Apana Vayu problems, abdominal disorders, retention of flatus, urine, stool, constipation, gas problem, Basti will be best. Musculoskeletal problems, for example, arthritis, backache, muscle atrophy, nervous disorders, Vata Vyadhi, doshic deficiency. For example, Vata dosha is always disturbed because of the 2 types of pathology: Dhatu Kshayajanya Vata Prakop and Margavarodhajanya Vata Prakop. Remember these 2 terms, very important. Dhatu Kshayajanya, deficiency disorders, undernutrition problems, and Strotorodhajanya, obstructive pathology, overnutrition problem like obesity, then atherosclerosis. These are the obstructive phenomena. Okay. So in both the conditions, you can treat these with the Basti management. Heart diseases, cardiac problems, psychological problems, hiccup, disorders of the Udana and Apana Vayu, fever, venereal diseases. In lot of indications are there regarding the Basti treatment. Basti is recommended in all types of Vata dominant conditions where main symptoms are pain and stiffness. So whenever there is a pain and stiffness, definitely you can use the Basti treatment. Proper timing. Basti is generally done in the morning, but follows seasonal indication. According to season, it little bit here and there. In late spring, summer, and autumn, Anuvasana Basti is given early morning. But in winter and early spring, the Anuvasana Basti is given in the evening. Okay. In Anuvasana Basti is always given after some food in the stomach. Remember this. Anu means after, Vasana means eating. So Anuvasana is never given on the empty stomach. Whenever you want, is little oil is given, but that oil should be given whenever there is little food in the stomach. After half an hour. After you take the breakfast, give half an hour after Anuvasana Basti. If you take the lunch, after half an hour, give the Basti. If you take evening some snacks, half an hour, give the Anuvasana Basti. Okay? So in this way. Types of the Basti, according to the site through which Basti is given. Normal Anuvasana Basti, Niruha Basti, they are given through the anorectal route. Uttar Basti, another type of the Basti, through male and female genitalia, like for example, vagina or the penis, through which some medicated oils are given, that is called as the Uttara Basti. We are going to see all these things in detail. Already there is video regarding the Uttara Basti on my Panchakarma, what you can say, the playlist, and on my Ayurveda Academy channel. Please check it out. Next, the medicated decoctions and oils are passed in GI tract, digestive tract, through the anal opening. According to the substance used for Basti, it is of 2 types. Main 2 types of Basti: Anuvasana Basti, where only oil is used. It may be simple sesame oil, it may be the medicated oils, Anuvasana Basti. But Niruha Basti is also called as Asthapana Basti. Write down, Asthapana Basti. But here, not only oil, but decoction or some paste of the herbs are used. So decoction plus oil, that is Niruha Basti, only and only oil, that is Anuvasana Basti. Simple to remember. Next, we will more concentrate on Anuvasana Basti in this video. In this type, oil is used, usually processed medicated oils are used. In the oleation, this is the oleation process, lubrication process. unjustness will be there and can be given daily in a very small amount. Okay. Generally, which oils are used? Bala oil, Bala Gudichadi Tail, Bala Ashwagandhadi Tail. Tail means oil. Then Lakshadi oil are used for degenerative pathology of Vata dosh. Dhatu Kshayajanya Vata Prakop. Must remember, Dhatu Kshayajanya is undernutrition. Dhatu Kshayajanya is a deficiency, like tuberculosis, like cancer, like HIV. Okay? But Sahacharadi Tail oil, Trifaladi Tail, that is oil, Chinsalavana Tail or oil are used for obstructive pathology of Vata dosh, that is Trotorodhajan Vata Prakop, and especially obesity or atherosclerosis type of the problems. Anuvasan Basti indications. Anuvasan, whenever you give the Niruha Basti, you can give definitely Anuvasan Basti. Remember this thing. Persons with extreme dryness, then you have to use this oil enema, that is Anuvasana Basti. In even pregnancy, this can be given. Matra Basti, very little amount with dose of 40 to 60 ml of Lakshadi Taila or Shatavari Taila is given in the 7th month of pregnancy by Ayurvedic gynecologist. Okay. Now, Anuvasan Basti contraindication, don't give. Where? Empty stomach should not be given. Acute fever, no. GIT, gastrointestinal tract, some problems like anemia, jaundice, anorexia, splenomegaly, don't use only Anuvasan. Of course, Anuvasan can be given, but alternate with the Niruha. Only Anuvasan continuously is contraindicated in all these Santarpanajanya type of the problem or obstructive type of the problems. Splenomegaly, ascites, liver disorders, hunger, diarrhea. Only Anuvasan is not recommended. Respiratory problems like coryza, productive cough, kaphajakas, kushta. Here specifically kaphajakas. In vatajakas, you can give little Anuvasan Basti or Matra Basti, no problem, especially vatajakas and constipation. Then definitely you can give Matra Basti. Kushta, whenever skin eruption with discharge, then don't give Anuvasan. Then Urustambha, frozen shoulder type of the complaint. Then ENT, nasal inflammation, eye inflammation. I'm sorry, here Urustambha is not a frozen shoulder, it's a slip of tongue. It's related with some thigh stiffness. Okay. Hormonal problems like diabetes, thyroid disorders, especially myxedema, don't give only Anuvasan. The abdominal pain due to the kapha, ama conditions, extreme obesity, intestinal parasites, worms, poisoning, and gout. Here only Anuvasan. I am saying again and again, only Anuvasan. It may be mixed. Alternate Niruha Anuvasan, yes, you can try for that. We will discuss further. Instruments, what is the instrument by which we can do Anuvasan Basti? Syringe is required, glycerin syringe. It may be the plastic syringe, it may be the sterile glass syringe, gloves, rubber catheter, number 11, 10, 11 or 12 as per the age of the patient. Then preparation of the patient, oleation and fomentation. Always it is required, Snehana and Svedana. Oleation is a Snehana. At least lumbar and lower abdomen, there is a gentle oil massage is done, and then fomentation with the hot water bag or the hot vapor, specifically that Basti, before giving the Basti, Snehana and Svedana is done. Then patient should be with the like breakfast or little bit food whenever you give the Anuvasan Basti. Preparation of Basti, make the oil warm, 40 to 45 degrees centigrade. The quantity of the oil substance is 1/4 that of substance used in the Niruha. In general, what is the dose? 60 or 120 or 250 ml oil is used for Anuvasan Basti. But majority, whatever we do in the foreign countries, maximum we use the 60 ml. Even not 120 or 240. Maximum times, try to, in the beginning, you must use little oil. 60 ml is sufficient. It should be always lukewarm water, lukewarm state. It should be warm, not too cold, not too hot. Okay. Then give administration of Anuvasan Basti. How it is done? Give the left lateral position to the patient. Left lateral position. This is asked in the MCQ examination. This is very important position for the Anuvasana Basti or Niruha Basti. Fill the syringe with warm oil. Remove the air from syringe as well as from the catheter. Lubricate the catheter and the anal opening with the oil swab, and insert catheter through the anus very gently. Push the oil with equal speed, neither very slow nor too fast. After removing the catheter, there should be tapping. Taran, it is called as taran. Where to do? On the lumbosacral region, buttock region, and ask the patient to remain in the same position for minimum 5 to 10 minutes. Okay? Basti pratyagama kal. That whatever the oil we push, when that particular oil or the stool should come out. Okay? If substance is not excreted in 12 hours, wait for 1 day, 24 hours. If substance is still not excreted and there are no adverse effects, forget it. Don't worry, be happy. But if the adverse effect appear, then you have to go for some management, like you can use the glycerin pastry called Dulcolax suppository. Rather, it should be called as a suppository. Okay, purgation with castor oil, that is resinous oil, erenda tail. Fermentation is done with hot water bag. Use of Tikshna Basti, like cow's urine. If it is not readily available, Gomutra Sava is a bottle available in the market. You can use, warm it little bit in the water bath, and then you can give Gomutra Sava also. Okay. Symptoms of properly affecting Anuvasan. When our Anuvasan is proper, it is called as the Samyak Yoga. Timely removal of waste products with oily substances, no adverse side effects, provide the nutrition for the dhatus in long run. Is not immediate. Is not the tomorrow or the day after tomorrow you can get the nutrition. Step by step, this oil will provide you the nutrition, lightness in the body, strengthening of the body increases in long run. Then, symptoms suggesting the incomplete action of Anuvasan Basti, asamyak yoga, body andadard ho jayega, dryness persists in the body, nausea will be there, drowsiness will be there. Anuvasan Basti after treatment, if the Basti dravyas are excreted in time, then little bit food can be given, light milk, warm and light and freshly cooked. These three things are very important. If oily substances are retained in the body without any adverse effect, then patient have to drink lukewarm water treated with dhanyak, coriander, and shunti, that is ginger, for proper digestion of oily substances. Light diet is always advised. Now, subtypes of the Anuvasan Basti: Sneha Basti, Anuvasan Basti, and Matra Basti. What is Sneha Basti? Sneha Bastis are used for Sneha Dravyas, unjust substances, fatty substances are used. The dose is 1/4 of the substance used for the Niruha Basti, about 240 ml. But there is also variation in the 240, minimum, moderate, and small dose. When you use the maximum, that is 240 ml, moderate dose 120 ml, and small dose, that is 60 ml. Okay. Anuvasan Basti, the quantity of Anuvasan is half of the quantity of Sneha Basti, that is 120 ml. And Matra Basti, the quantity of Matra Basti is half of the Anuvasan here, that is a 60 ml. This type of Basti is the safest. Every day you can give the patient Matra Basti. Now, finally, the effects of Anuvasan Basti is superb, cures many Vata disorders, produce the clarity of the mind and senses, promotes the energy, strength, complexion, and Agni, supports all metabolic processes of the body. If anybody, viewer, is interested to get paid online consultation, you can WhatsApp me on 9226810630. This is a educational video, so be careful that all the treatment should be done under supervision of skilled and experienced doctor. I request all my friends to please share this video, like this video, and don't forget to subscribe my YouTube channel and press the bell button icon to get a interesting series of Panchakarma by Professor Dr. Deshpande. I wish all the best. Take care and bye-bye, and see you in the next video regarding Basti also. Thank you very much. Take care.